Hello everyone. So has it ever crossed your mind that why is the 5% DA or the 5% dextrose in Aqua contraindicated in the treatment of hypovolemic shock? The 5% DA or the 5% dextrose in Aqua is actually loaded with glucose. The dextrose will be converted into the glucose in any way. So this fluid is contraindicated in hypovolemic shock due to some particular reasons, right? So to know that, we have to know at first what happens to the body in case of hypovolemic shock. As it says that hypovolemic shock, that means hypovolemia has occurred. So there will be decreased ECF volume, so the perfusion, the tissue perfusion will be less, and the decreased amount of ECF volume or the decreased blood volume will deliver less amount of oxygen to the tissues. And therefore, in the absence of most of the required oxygen, there will be anaerobic respiration at the cellular level. And the end product of this anaerobic respiration is lactic acid, and accumulation of lactic acids will lead to metabolic acidosis in our body. The mixed venous saturation will be less than 50%. As this is hypovolemic shock, it is less than 50%, and the normal range is 50 to 70%, and in case of septic shock it will go above 70%, and we will talk that that topic in details in some other videos someday. So now moving forward, what are the other findings here? The pulse will be raised, the blood pressure will be falling down too rapidly, the urinary output will be less, and the patient will be sweating, and the skin will be cold and clammy. So all these are the net effects of hypovolemic shock in a patient. So keeping all this in our mind, we are now going to learn what actually happens when you infuse the 5% DA. We already mentioned that the 5% DA is actually containing the glucose, right? And the glucose is highly osmotically active, and it has a tendency to move into the highly concentrated area. So when you infuse the 5% DA, it goes into our ECF, right? And the 5% DA obviously contains a certain amount of fluid, and as the glucose gets in contact with a lot of fluid here, so this compartment becomes hypotonic, and the glucose will obviously want to move from this ECF into the ICF, and glucose has a tendency to move from ECF to the ICF due to its being highly osmotically active. And this movement of glucose is aided by presence of loads of glucose transporting receptors on the cells of our body, and the insulin will help the glucose to move through these receptors, all these receptors present on the cells. So the water of ECF now will follow the glucose, and the glucose has moved from ECF to the ICF. So the water will also move into the ICF from ECF due to the osmosis, and it is a simple osmosis, right? So the 5% DA actually becomes hypotonic when it is administered into our body. So this is a very big disadvantage, that the glucose actually moves from ECF to ICF due to its nature, due to its being osmotically active, and it will draw the most of the amount of the water from the ECF into the ICF, and therefore there is not that much of increase in the ECF volume. So this is one disadvantage. And now how the water will be distributed into the body after infusion of this 5% DA. This will exactly be as same as the total body water distribution. 2/3 of the total body water gets into the ICF, and 1/3 gets into the ECF, right? And of this ECF, 1/4 goes into the plasma, and 3/4 goes into the interstitial fluid. Now, if you infuse a patient with 1 liter of 5% of DA or 1000 ml of 5% of DA, 2/3 will stay in ICF, as we said. So 666 ml will stay in, or will go into the intercellular compartment, or the ICF, and the 1/3 will remain in ECF. That 1/3 of 1000 ml is 333 ml approximately. And of this ECF volume, 84 ml stays in plasma and 250 ml goes into the interstitial fluid. So you can see that after administration of 1000 ml of 5% DA, you can actually expand the plasma volume by only 84 ml according to this distribution. So this is too less, right? This is too less. And suppose a patient comes to you with a history of 1 liter or say for 2 liter of blood loss or fluid loss, and you want to expand the plasma volume by 1 liter, right? So if you infuse the patient with 1 liter of 5% DA, you can actually expand the plasma volume by 84 ml. So 84 ml is added to the plasma when the infused volume is 1000 ml. And you want this. You want expansion of 1000 ml or 1 liter to the plasma. So 1000 ml is added to the plasma when the infused volume of 5% DA is 12,000 ml or 12 liter according to the calculation. So 84 ml is added to the plasma when the infused volume is 1000 ml. So 1000 ml will be added to the plasma when the infused volume is 12,000 ml or 12 liter. So this will be totally nonsense to infuse 12 liter of any sort of fluid into a patient, whether he or she is in shock or not. Infusing 12 liter in a patient is a risky thing and is totally nonsense, right? So this thing actually proves that the 5% DA being hypotonic is actually harmful for our body in the treatment of hypovolemic shock. There is not that much of increase in the plasma volume after infusion of 5% of DA due to its being hypotonic, due to the glucose being osmotically active and drawing all the fluids from ECF into the ICF. So there is one disadvantage, and there is one reason that we will not administer the 5% DA into the hypovolemic shock patient. And there is another reason, that is, we've already said that there is anaerobic respiration maintained in a hypovolemic shock situation, and the net product is lactic acid, which will lead to acidosis, right? So in case of a healthy individual, the healthy individual will be able to maintain aerobic respiration, and all the glucose in his body will be utilized in the aerobic respiration, and there will be no lactic acid formation because the aerobic respiration does not permit the production of the lactic acid in a normal way. So this is okay, and this is maintained in a healthy individual. But in a severely ill patient, say for hypovolemic or hypoxic patient, he or she will not be able to maintain aerobic respiration as there is decreased oxygen due to hypovolemia. So there will be anaerobic respiration at the cellular level. And already in a hypovolemic patient there is anaerobic respiration. Moreover, on that, if you infuse the 5% DA on that patient, this anaerobic respiration is going on and you are infusing the 5% DA, and of this 5% DA, 85% of the infused glucose will be diverted to the lactate production, because all these infused glucose in the 5% DA will take part in that anaerobic respiration because of lack of oxygen in that hypovolemic patient. So that 5% DA containing glucose, and most of the glucose, or 85% of the glucose, will be diverted to lactate production due to that anaerobic respiration, and there will be more lactic acid production, and there will be the worsening of the acidosis. So in case of a normal healthy individual, infusion of 5% DA is okay. The glucose will be utilized in aerobic respiration, but in case of a hypovolemic patient who is undergoing any sort of anaerobic respiration, it is harmful to infuse any fluid that contains glucose, because that glucose, most of the glucose of that infused fluid will take part into that anaerobic respiration, and most of the glucose will produce this lactate or lactic acid, and this lactic acid, this increased amount of lactic acid will lead to more and more acidosis, and there will be worsening of acidosis, and the patient will be having serious troubles than before. So these are the two reasons, this worsening of acidosis and this fluid being hypotonic here, as we have said there, due to this shift of fluid following the glucose. These are the two reasons. That's why we won't administer the 5% DA in a patient of hypovolemic shock. So that's it.